Welcome, everybody,
to the Dr. Carolyn Dean Live Radio Show, featuring Dr. Carolyn Dean, along with host Ginny Sanders,
also known as Ginny Almighty,
who joins Dr. Dean on tonight's program.
Phone lines are now open at 602-666-6027.
That's 602-666-6027. And we'll be taking your calls from around the world and right here in the USA.
Welcome everyone, live with Dr. Carolyn Dean here on Monday, March 30th, 2020, in our ever-changing world in which we live in, ladies and gentlemen. Once again, Dr. Carolyn Dean, the author of the Magnesium Miracle, and such an extraordinary doctor and leader in her own right, as one who has been an advocate for nutrition and natural medicine for so many years, 50 years, a leader in the health freedom movement, an author, international bestseller, and also one of the things, another just incredible attribute of Dr. Dean is a member of the orthomolecular community, an editorial member of the board of the Orthomolecular News Service. And orthomolecular meaning, ladies and gentlemen, the right molecule. This is a group of people and individuals who are committed to doing medicine the right way. And Dr. Dean is going to be speaking more about that with our guests this evening, many of which who are also partners with her in this work and this communication to get out very special information tonight about the role of nutrients in working with COVID-19 and other health symptoms, other health systems. As this situation abates and we move into new worlds and new opportunities, we are always going to have the challenge, ladies and gentlemen, of taking care of our own health. Before I bring her on, I'll just remind you that Dr. Dean does not practice medicine on her radio show. That would very much be against the rules, but she is very willing to share with you the thoughts and wisdoms that come out of the medical community about various disciplines and opportunities, and tonight is no exception. So before we go any further, let me bring her on and introduce her again to the audience. So welcome again this evening, Dr. Carolyn Dean. Okay, Carolyn, I do not see her.
I forgot my mute button. I'm here. Sorry. Yes, not much preamble today because we'll get right to our show and our guests, but I think our guest, who Ginny will introduce, our first guest, Dr. Tom Levy, I think Dr. Levy would be interested in our magnesium deficiency quiz or survey. We've had it on our website, the RNAreset.com, since September 2019. So far, we've had about 25,000 people answering this quiz. And the questions are very simple, but what's shaping up is the extent of the magnesium deficiency in the population. The first question, do you experience anxiety? We have yes as an answer for 67% of those 25,000 people. For insomnia, 66.2%. For muscle cramps, 51%. Heart palpitations, 47.4%. Restless legs, 46.3%. Headaches and migraines, 33.2%. So we have got a severely magnesium deficient population who are visiting our website. And as Ginny says, our motto is to help people repair their nutrient deficiencies and support the structure and function of their body. The Yes, the blog that Ginny sent out today was introducing Dr. Levy. So let's get right to that. Ginny, can you give the introduction?
Yes, and welcome to the show. And Dr. Levy is a board-certified cardiologist and a bar-certified attorney. And after practicing adult cardiology for 15 years, he began to research the enormous toxicity associated with much dental work, as well as the pronounced ability of properly administered vitamin C to neutralize this toxicity. He's now written 11 books, with several addressing the wide-ranging properties of vitamin C in neutralizing all toxins and resolving most infections, as well as its vital role in the effective treatment of heart disease and cancer. Others address the important role of dental toxicity and nutrition in disease and health. Recently inducted to the Orthomolecular Medicine Hall of Fame, Dr. Levy continues to research the impact of orthomolecular application of vitamin C and antioxidants in general on chronic degenerative diseases. His ongoing research involves documenting that all diseases are different forms and degrees of focal scurvy, arising from increased oxidative stress, especially intercellularly, and that they all benefit from the protocols that optimize the antioxidant levels in the body. He will regularly give lectures on this information at medical conferences around the world, and his 11th book, The Hidden Epidemic, Silent Oral Infections Cause Most Heart Attacks and Breast Cancers, was published in September of 2017, and we're so thrilled to have him on the show this evening, and so very much welcome, Dr. Levy.
Very happy to be here, and just a little point, it's Levy.
Levy.
Levy. Okay, Dr. Levy, let me just start this off by telling people that yesterday when we were talking, you told me that your mantra for this virus is that nobody should die. So that's your leaping off point, and I'm sure you could go on for a long time to tell us why you think that. If you just go ahead, please.
Well, and that's not just a slogan. That's actually what I believe to be the case. I think, as I mentioned to you yesterday, nobody should die at this point in time from coronavirus unless, of course, they get some of the interventions that we'll talk about maybe 10 or 15 minutes before they're ready to die anyway. But if you are able to administer the therapies that we'll talk about within a reasonable amount of time, even after intubation, not necessarily just has to be before, but even after intubation, nobody should die, absolutely.
Right, and I think the focus has started to be, well, let's wait for them to need that respirator and make sure they get their respirator instead of realizing that we can support the lungs. And what we are talking about today is vitamin C, oral and intravenous. We're also going to talk about the hydroxychloroquine, which the FDA has released on just yesterday, Sunday, they approved its use in treating the coronavirus. So we're very happy about that because any medical person knows that this treatment for malaria has been around. I think Dr. Levy told me yesterday it's 80 years, and it has very low side effects. So we're happy to see that. So I think I'll just jump right into the first mailbag question we have from our listeners. Jonathan asks or says, I've heard that ascorbic acid is not a true form of vitamin C and causes other issues. This comes from holistic recommendations to find sources of all natural vitamin C. So I think we have to put that answer to bed right at the outset because it's on a lot of people's minds, especially, Dr. Levy, since I do promote more the food-based vitamin C. So can you discuss that topic?
Sure. In a nutshell, with all due respect to the questioner, it's really outlandish. Vitamin C is ascorbic acid. Ascorbic acid is vitamin C. Now, the part of ascorbic acid that is the essence of vitamin C is the ascorbate anion. Hydrogen is the cation. You could have sodium ascorbate, calcium ascorbate, magnesium ascorbate. They're all vitamin C with a different cation attached to them. Now, with regard to food-based vitamin Cs, let me say that vitamin C is the premier antioxidant in your body. But all antioxidants work together. I like to say you like to establish in your body an optimal matrix of different antioxidants all working together to regenerate each other back to the reduced form once they're oxidized by a toxic or oxidative stress. However, so the more optimal things you take in your food, anything that's a nutrient is antioxidant in nature once it breaks down to a biomolecule. So if you eat perfect food and it's nutritious, it's only nutritious to the degree that it ultimately metabolizes down to a molecule that has antioxidant or electron donating capacity. So in that regard, yes, the more different, wonderful antioxidant nutrient substances you take with vitamin C, the better. But, and this is where a lot of confusion comes because, I don't know, everybody's trying to sell their product, and in trying to sell their product, they try to put down something that should never be put down. We have 80 years of literature that shows vitamin C by itself, ascorbic acid or sodium ascorbate most prominently, has cured a whole host of viral syndromes, bacterial syndromes, even protozoal and fungal syndromes, and neutralized an almost uncountable number of toxins. Now, does that mean you might not have a little better effect if you had other antioxidants with you? Of course. But it should never be taken to the point that you minimize the fact that vitamin C is ascorbic acid, is ascorbate. And individuals, I don't know, they have vested interests. Maybe some of them sincere, maybe some of them are trying to mislead, but they'll say ascorbic acid is not vitamin C. They'll even say crazy stuff like vitamin C can cause cancer or vitamin C can cause kidney stones. Bottom line is it's been around for 80 or 90 years. It's dealt with all these syndromes all by itself, but if you want to take additional things, just like additional good nutrition, then great. But just don't minimize what vitamin C has done repeatedly, documented in the literature, all by itself.
Very good, very good. Yes, I have some trouble understanding the sort of the top down, but bottom up, what you're saying is that the molecule of ascorbate is and always will be a molecule of ascorbate wherever it comes from, and that it's mainly this transfer of electrons back and forth that keeps the antioxidant of that ascorbate working.
Yes, absolutely. And the interesting thing about ascorbate is that it's derived from glucose, so it's a very simple molecule, very close to glucose in structure. And because of that, and this is what makes vitamin C superior among all the antioxidants, is that as glucose, it gets everywhere in the body. It uses the transporters of glucose to get into the cell. It crosses the blood-brain barrier. There's not a cell in your body that does not utilize vitamin C as the primary source of electrons, donating them to glutathione, which is the most concentrated antioxidant inside your cells. But in addition to that, vitamin C, as a small molecule, donates 2 electrons per molecule. Most other antioxidants donate only 1. So this gives it a little more power, if you will. So, and other fuels, if we say, a lot of people say, oh, you're taking so much vitamin C, you're just making expensive urine. Well, as your car runs out of gas, you got to continue. If you're driving it a lot, you have to continue to put gas in it. Well, you have to continue to put vitamin C inside yourself, no matter how much you excrete, because you absolutely rely on the amount that's absorbed and assimilated in your body for your every daily functions. And you combine that with the fact that a lot of people say, well, why can't you get enough vitamin C in your diet? Eat a lot of fruit, eat a lot of vegetables. Well, vitamin C is unique among all the vitamins and really all the minerals, because all the other vitamins, all the other minerals, theoretically, perhaps except for magnesium, you can really sustain yourself on a quality, organic, properly digested diet. However, with vitamin C, compared to the other animals in the animal kingdom, we have the gene, but we lost the ability to transcribe it inside our livers to make vitamin C from glucose. And when you look at an animal that's about the size of a human, they'll make roughly 10,000 milligrams of vitamin C a day and deliver it directly into the bloodstream, which means an overwhelmingly much larger amount of supplementation would be needed to ever approach that amount of delivery from your liver. So this is why vitamin C is unique in needing to be supplemented, even though it might seem counterintuitive to some people, but it makes no sense. If I eat a quality diet, I should get enough. Yes, for most things, but not for vitamin C.
Perfect words. Very good, very good. And we're at that perfect storm where people aren't taking enough vitamin C. They're not getting from their diet. As you say, their liver doesn't make it, we've lost the ability. And also, you did bring up our favorite mineral, magnesium. And actually, Ginny, I should add to Dr. Levy's book collection, his latest book is actually Magnesium, Reversing Disease. And I want to ask you, since you're an expert now in magnesium as well as vitamin C, years ago you said that vitamin C deficiency, and you said here as well that scurvy was the basis of so much chronic disease, and of course we say that about magnesium deficiency. So where do you place vitamin C and magnesium? Are you saying now that magnesium is more important than vitamin C? I'm kind of teasing you, but what do you say about that?
It's a good question. I would say that they're equally important insofar as in order to get a normalize the level of oxidative stress inside your cell, which is what you need to have a healthy cell, you need both magnesium and vitamin C. Your four primary constituents inside the cell with regard to redox balance are calcium, magnesium, vitamin C, and glutathione. When you have high calcium, you have low magnesium and low vitamin C and a lot of oxidative stress. When you can push both magnesium and vitamin C inside the cell, the calcium comes down, and you have the potential not only to bring that intracellular oxidative stress into a normal range, but when you do that, you actually have restored the cell to a normal state, no matter what disease process it might have been involved with earlier. So, but, and this is sort of cute, I think, when people say, well, which supplements are the most important, I have to be honest and say the magnesium is the most important over vitamin C. Well, why would I say that? Well, with vitamin C, there are many other antioxidants that they can't compensate for vitamin C, but they can partially compensate for vitamin C. So if you're taking in a large amount of antioxidants in the face of a vitamin C deficiency, you'll still get some antioxidant effect as you take the other antioxidants. But with magnesium, when you're deficient in magnesium, nothing can deal with that deficiency other than magnesium. So in that regard, I would say magnesium is a more important supplement because nothing else can take care of the role.
Correct, right. Awesome. Right, and in reading your book, you're one of the first people who's taken the Workinger quote where he says 80% of known metabolic function requires magnesium, and that is just so vitally important. And I did the math from there. I took the known number of enzymes in the body. I think it's around 1350, and just did the math. 80% of that is about 1,000 enzyme processes that magnesium is identified with. So I've taken to saying that instead of this very low number of 300 to 325 enzyme processes. So yes, we know the importance of magnesium, and I appreciate your work and you're writing this book. Dr. Levy has about 1,000 references in his book, so it's quite a feast for researchers. And the name again is Magnesium Reversing Diseases. Actually, when I did Magnesium Miracle, the 2017 edition, I identified at least 65 diseases that are related to magnesium deficiency and can be treated with magnesium, although we're not allowed to say that. Okay, let's go to a couple of other questions that have already come in before we take phone calls. D. Solomon says there isn't. Go ahead, Jenny.
Carolyn, I wanted to let you know Dr. Michael Gonzalez is on the phone from Puerto Rico.
Woohoo! Okay, that's very good. Let's go there because Dr. Gonzalez is in the forefront of working with vitamin C, intravenous vitamin C as well. Let's see what he has to say.
Okay.
Yes, Dr. Levy, do you want to introduce Dr. Gonzalez? You know him better than we do, or will we just go to his bio?
I think it would be good to go to his bio. I wouldn't want to miss anything important. I mean, he's a very accomplished individual, a founder, forefather in vitamin C research, so let's not miss any important details.
Very well said. Go ahead, Jenny, then.
All right, very good. Dr. Michael Gonzalez is a professor at the nutrition program at the School of Public Health and the Medical Sciences campus at the University of Puerto Rico. And he is an author of over 100 scientific publications. He is an active member on several scientific journal editorial boards, and as a consultant for several companies, he has been responsible for designing formulations of nutritional supplements and pharmaceutical products. At present, he is a consultant for the Center for Improvement of Human Functioning in Wichita, Kansas. He has obtained several research awards for his work on nutrition and cancer. Welcome, Dr. Gonzalez, this evening with us.
Hi, it's a pleasure to be here with Tom. Tom, we have long stories. One of them is that we were inducted to our Molecular Hall of Fame the same year. So it's an honor to really be with Tom in this program.
Absolutely.
Tom is a real special person.
Oh, yes, we know that, and we're hearing that. So tell us, Dr. Gonzalez, are you working with people who have COVID-19 down there in your clinics?
Not really. We have people suspicious that are taking the test, and the thing is that the real issue here is that a lot of people are using vitamin C, but I think the doses that are using are very low, and I think that may even hurt this movement in the sense that these small doses may not have the impact that the large doses that we're applying may have on people. We have more experience treating influenza. We have treated chikungunya, Zika, mononucleosis, but not with this type of virus. But anyway, as Tom was saying, the experience with vitamin C, it says vitamin C has many mechanisms, many antiviral mechanisms, some direct, some indirect, but there are non-specific. So it works for most of the – I haven't seen a virus yet that has not succumbed to high-dose vitamin C. And I think Tom will probably back me up on this one.
Right. So tell us the dosages. That's the next question that we should get an answer for. What dosage
let me tell you.
orally?
Yes.
Yeah.
Well, let me tell you. In terms of what we've seen that the hospitals are doing, at least the information we have from New York, is that they're using 1.5 grams like every 6 hours, I think that's too low. We will probably use 10 times that in order to have an effect. I think with this virus, when people are really sick, I think the first thing you should use is vitamin C. I think the rest of the things, maybe the antimalarials, the antibiotics, the zinc, are very important also, but I think they're secondary to the effect of vitamin C because, number one, but when you have circulating high dose of vitamin C in blood, you may even disturb the virus capsid, which is that protein that, that it sticks to the cells because it has these type of spikes. Vitamin C will probably disturb these spikes, and the virus will not be able to attach to the receptors that they normally attach in the lung and in the heart. So you're going to have a direct effect upon the virus when you have high doses of vitamin C because of the mechanism that Tom was explaining about the oxidation reduction, that electron movement that vitamin C has. The other thing is that it has other indirect mechanisms, like, for example, you increase the chemotaxis. I mean, you increase the reactivity of the white blood cells, you increase their number, you increase the B cells, and the antibodies. You also increase antiviral proteins like interferon, and you do it in a way that it's not toxic. So if you could use interferon like they're using in some hospitals, but it has a lot of side effects. When you increase interferon with vitamin C, you don't have those side effects. So it has a lot of advantages. And the other thing is what Tom was probably explaining about the mop-up of the cytokine storm, which is life-saving. I mean, it's life-saving. It's the only thing that can probably do that. You combine it with NAC, NAC, maybe glutathione, and quercetin and zinc, and you have something that could really battle this virus and save a lot of lives.
Well, let's talk about oral use, the preventative use of vitamin C. What dosages would you say to use, Dr. Gonzalez?
Yeah. Well, we're advising at least 1 gram 3 times a day.
Right. 1 gram 3 times a day.
People who do not have the chance of getting the IV vitamin C, even if they feel sick, they may use the bowel tolerance dose model of Cathcart and combine, with the knowledge of Steve Hickey's dynamic flow, which is basically trying to take enough vitamin C until you develop diarrhea. That's the cutting dose. Let's say it takes you, normally people maybe 10, 12, 15 grams get diarrhea, but when you get sick, you absorb more. You're going to need more. So you probably, in a disease like this coronavirus, you probably need maybe more than 30, 50, maybe even more grams of vitamin C. But once you started getting diarrhea, it's that you have to stop. So that's the cutting dose. A little bit, let's say you got it at 50, so you probably need 45 or something like that in order to battle this virus. So you probably have to do this for a couple of days.
Right.
And the bowel movement will tell you when you have to decrease your dosing.
Right. Now, that's when you're just using vitamin C, but then, as we were talking about before you came on, the importance of magnesium. Of course, we're telling people to take their magnesium. And you know more than me about that, but, magnesium is involved in almost every metabolic movement that the cell does. So you need magnesium. So, here's my question.
I think everybody's kind of insufficient in magnesium.
Yes. Well, let's ask Dr. Levy, if we're using magnesium as well as vitamin C orally, we're talking about prevention and treatment of the beginning of any virus, and also vitamin D. If we use all three, we don't necessarily need to have high amounts of any of the three. Would you agree, Dr. Levy?
Yes, I would. It's a very timely point that you just made there, Carolyn, because most of us that have been dealing with vitamin C know the history of the literature and know, for example, that Dr. Frederick Klenner in 1938, published in 1939, treated 60 cases of polio, babies and infants, using oral and injectable vitamin C, and he got a cure in 57 out of 60 in 3 days, and in the other 3 patients, he got it in 5 days. Now, I say that because, and I think you're well aware of this, but let's tell the people that are listening, it also turns out in France in the 1940s, a physician, I don't know what his inspiration was. I think he realized that magnesium in general was good for infections. But anyway, he had the occasion to do an oral magnesium chloride, not magnesium sulfate, not magnesium anything else, magnesium chloride. And he did it on young people and adults that had polio, and he got the same, if not slightly better results than we saw with vitamin C. One case resolved in 24 hours. Several cases had the polio for several months and had a flaccid paralysis, and it reversed the paralysis as well. And we're just talking about a monotherapy with magnesium chloride solution several times a day. So in line with that, I would absolutely agree that one of the most profoundly effective and economic approaches toward preventing any significant viral infection would be the regimen of vitamin C along with magnesium, and I would add zinc as well.
Well, of course, of course. Actually, one of our mailbag questions I was about to ask was someone saying, there isn't enough vitamin C to go around. Promote zinc. So let's talk about zinc, how much to take, and also the importance of it, as you pointed out to me, Dr. Levy, with hydroxychloroquine.
Hydroxychloroquine,
that's fascinating. Yes, thank you. Hydroxychloroquine. If you would tell that story.
Sure. Well, there's an abundance of literature showing that zinc is an ion, a mineral that's very effective in combating infection. And, the zinc lodges in sore throat. However, zinc is very difficult to get inside the cell, okay? And a lot of the studies show that once zinc is inside the cell, not only does it's a general antiviral, not just for coronavirus or anything else. Well, as it turns out, chloroquine or hydroxychloroquine is an ionophore, which is just a big word meaning that it opens up a portal that allows the ionized form of zinc, which has a very difficult time penetrating the cell wall, to easily get inside the cell. And once it's inside the cell that is infected with virus, or the virus is avidly replicating, the zinc completely stifles the RNA polymerase that allows the virus to continue to replicate, and then ends up resolving the viral infection very quickly. So, and this is a very consistent and reliable outcome. Everybody should know how pro-vitamin C I am, but I would have to say, for the purposes of this pandemic, if everybody had 4 or 5 pills of chloroquine to take, it would all be over very quick because it's that powerful and antiviral. And so far, in many of the preliminary studies that are coming out, it's working pretty close to 100% of the time at this capacity. Now, obviously, if you can, you want both. But I would say, again, when you're approaching monotherapies, when you're approaching availability around the world, being able to have the accessibility to this chloroquine is enormously important. And just like vitamin C, what do? Oh, you're going to get kidney stones. With chloroquine, oh, you're going to go blind. All of this is poop, okay? These are things that take place over a very high doses over extended periods of time. I seriously doubt in the history of chloroquine anybody has gone blind after taking 2 or 3 500-milligram pills, and that's all we're talking about here.
All right, right. Yeah, that's wonderful. And I'm going to interject here, doctors, that we work with zinc in our multiple mineral, and our zinc, it's a low potency in our Remite multiple mineral, but because it's a stabilized ion of zinc, it will get into the cells. It will pass through the mineral ion channels. So if we're getting zinc into our cells, and I am not saying that this is going to stop the COVID, but I think our people who've been on their Remite minerals are well set up to be protecting the structure and function of their immune system against viruses. So I'll just put that out there because I know on the chat people are going to be asking.
Carolyn, one thing I wanted to add to what Tom said. Tom is totally correct, as usual. But one thing is that they're mentioning a lot about the hydroxy. I forgot
chloroquine,
the
yeah. Chloroquine, yes.
But they're not mentioning anything about the zinc or anything about ascorbate. So that's the real sad part of this. Because it seems as a group, these medications and these vitamins are working exceptionally well. But they're not mentioned.
Yeah. Well, I know.
Let me throw this in. We talked about this yesterday, Carolyn, and I think it's anecdotal, okay, but guess what? I'm a physician, and when a physician tells an anecdote, it's a case report. So a case report can be published. So what I would like to say is I was shaken to my core about 4 days ago when my best friend, 52 years old, extremely healthy, takes all the supplements, has been compulsive to the nth about hygiene and everything else, was feeling fine early in the day. He took out his garbage, and when he came back, this guy's a weightlifter too. He came back, he took 3 minutes to get his breath back. I mean, taking out the garbage, knocked out his breath for 3 minutes. And over the course of the next 10 hours, he quickly went into acute respiratory distress, really basically pulmonary edema, could barely breathe. And because, God bless his soul, he's extremely intelligent, he had managed for an emergency's sake to get a hold of some chloroquine a few days earlier. He didn't even have enough energy to call the emergency room. He took one of the chloroquines, 500 milligrams, and started coming out of it 2 hours later. Then took a few more, and he's fine. And he was about 60% the next day, and after that, 80%, 90%. Point being is, this virus can take you out, and I don't mean to alarm people, but they should be aware. We're trying to tell the facts here, the facts as we know it. Although many people have an asymptomatic benign infection for reasons we do not understand why, it takes some people out, it takes them out quick. All this stuff about respirators, mechanical ventilators, all that's doing for most people is prolonging the inevitable. If you go into acute respiratory distress syndrome and then get a tube put down your throat and you go on a ventilator, for most people, that just means you're going to die 2 weeks later than right away, unless they start giving you large doses of vitamin C and or get you going on the chloroquine. And the zinc is obviously extremely important, and the more zinc you have on board, the better. The one fella with the acidic community in New York treated some 700 patients. His protocol was 200 milligrams of hydroxychloroquine twice a day, whatever the standard dose is of azithromycin, and, listen to this, for a 5-day period, he would put them on 220 milligrams of zinc a day. I don't know what for. But the point is he loaded them up with zinc so that there was plenty of zinc available for the hydroxychloroquine to push inside the cell and knock out the virus. So everybody understands. You never take that much zinc chronically. Zinc has toxicity, and on a regular basis, you don't want to take more than 20 to 40 milligrams. But in the case where you're fighting something like this, you can load up on it and really sharpen the knife, if you will, of the hydroxychloroquine or the chloroquine.
Right. Okay, let me go to this question. I'll preface it by saying this is someone who has obviously not read my Death by Modern Medicine book. Jim asks, if vitamin C is so great, how come we're not hearing more about it in the news media? And we've gone through this. I'm telling you, our group here, we belong to the Orthomolecular Medicine News Service. Our hero, Andrew Saul, has put out, maybe 20 press releases about using vitamin C, and very few people have picked them up. And it's the focus of allopathic medicine, who wants to make it be about taking a drug. And even though we have a good drug, the hydroxychloroquine, half of the media is putting this down as, well, it hasn't been tested on COVID-19. So it's like they want us to do a year-long trial on COVID-19 while people are suffering and not use it. So we're in the middle of that as sort of the political dilemma with natural medicine versus alternative medicine. So the next questions, we're talking, a couple of people, Dr. Levy, have asked about using the liposomal vitamin C. And you apparently are an expert in that. Do you think that's a better form of taking an ascorbic acid? However, they're telling me that the product is becoming unavailable.
Well, in fact, vitamin C is becoming unavailable just about everywhere right now.
Any form of vitamin C is unavailable.
Yes, yes. So it's interesting, too, because the people and the physicians that are aware of how important vitamin C is represent a very tiny percent of the people on the planet, yet that community was huge enough that when this viral pandemic got going, everybody said, boy, I better get stocked up on my vitamin C. So right. That's just a testament to the fact that how important it is.
Right.
But the vitamin C, the liposomes are very good at getting the vitamin C inside the cell. The only thing that I would say, and it's probably beyond the scope of our little talk right here that we're having right now, is that in the supplement industry, sad to say, there's a large amount of fraud. People just want to jump on a bandwagon and make a lot of money. We know the story. Well, there's only one company that I know of that makes a quality product. There might be other quality products, but I don't know who they are. And so to that, and of course, for anybody that's wondering, right now they're back ordered, just like it's difficult to find vitamin C of any type anywhere else. But it's a shame that so much that is human nature to try to be fraudulent like this. The problem is this fraud really happens easily because all the products that call themselves liposome products still do have vitamin C in them. And the fact of the matter is, if you take vitamin C of any form on a regular basis, you're going to do better. So most of these people take these quote-unquote liposome products and they feel better and they think they got a good product, but they really didn't get anywhere near close to the ability of the liposome, and this is the important part, to get the vitamin C inside the cell, not just in the blood, but inside the cell and without the consumption of energy. Because when you have vitamin C circulating in the blood, you still need to consume energy to get it inside the cell, and that's not the case when it's encapsulated in a good liposome.
Right, and in terms of answering people who are asking, well, what am I going to do? I support a biodynamic organic farm here in Maui, and I go up to help out at the market. We're still open for business, and everybody was all over our fruits. You can get 200 milligrams of vitamin C in a small orange, et cetera, So go after your fruits and berries. Dark berries have all the antioxidants and a lot of vitamin C. So don't neglect your fruit. I'm very big on treating yeast overgrowth, so I give people a waiver that you can eat your fruit now for your vitamin C during this crisis.
Well,
Go ahead.
Let me say this, Carolyn. I'm sure there's some other things that are slipping away from me right now, but the things that are most potent against the virus are ozone, vitamin C, the treatments of a plasma transfer where you take the antibodies of a patient who had and is over the coronavirus and infuse it. That's been very effective. The hydroxychloroquine and the chloroquine. And there's one other thing that's extremely effective and probably the cheapest thing on the planet, and that's hydrogen peroxide. I have been advocating for some time now, especially if you don't have access to anything else, but I don't think anybody should avoid using it anyway because it can stop things before they start. Where are they testing for the coronavirus? In the nose, before they went to the back of the nose, close to the pharynx, okay? Guess why they went there? They went there because that's where the virus multiplies. So hydrogen peroxide is arguably the most potent general antipathogen, viruses included, that you can have. And it costs about 80 cents for a pint of it at Walmart. Now, when you get any sort of flu, any sort of respiratory virus or coronavirus, they all share this rapid and continual multiplication and replication in your sinuses, your nasopharynx, your oropharynx, your throat, your upper respiratory, and even your lower respiratory tract, which is why some cases progress so fulminantly inside the lungs is because, for whatever reason, they're propagating more prolifically in the upper and lower respiratory tract. And this is continuing to feed the virus load throughout the body. Now, if you can, as I say, chop the head off a snake and knock out that virus replication, then most people, unless they're just a few minutes away from death, they can then, with their own immune system and, of course, with the help of vitamin C and these other things we're talking about, they can mop up the virus and the rest of the body quite readily if you stop the new virus from coming in. And by nebulizing, nebulization is a fine mist with a special machine that you can inhale. It's available outside the hospital, but you know, whenever you see anybody going to get asthma, breathing treatment, that's what they're using. They're using a nebulizer. You nebulize 3% hydrogen peroxide. Most people need to dilute it a little bit because it might burn or sting a little bit. But if it doesn't burn or sting, it's because your mucous membrane is already coated with pathogens and it's eating up the biofilm and then killing the pathogens. Do this several times a day if you have any sort of upper respiratory tract symptoms. Do it once a day if you're just in an area where you think you have a high exposure. I do it every time I come off the plane. The plane has gotten me sick so many times. Well, I've never gotten sick since I've started this nebulization. So it's very effective, very cheap, virtually completely non-toxic. Some people said, I had a whole bunch of problems with it. Well, they put it into an aerosol mist and inhaled it all night long. We're talking about 5, 10, 15-minute treatments, okay? So anybody who can screw something up, no matter how straightforward it is, but this is very simple. You put the peroxide in your oropharynx and nasopharynx, direct contact. It chews up the biofilm, which keeps pathogens normally from being accessed by an antibiotic. No antibiotic can penetrate a biofilm. So it knocks out the biofilm, kills the pathogen, and then you stop supplying new virus to the rest of the body, and you either never get the flu, influenza, or coronavirus, or if you've already had it, you're then in a position to resolve it much more quickly.
Excellent. Excellent. Now, let me just say, though, a teaspoon of hydrogen peroxide and a teaspoon of saline or distilled water, our people will ask for specifics.
Well, the general hydrogen peroxide comes as a 3% solution. I have found in my own personal experience, there have been a few times when I was really congested. I clearly had something going on, and I did the 3% full strength, and I had no burning or tingling. It was all being used up, presumably, chewing up the biofilm and the pathogens. On the other hand, there have been some other times when I've been feeling well, and I say, well, let me just do a little preventative treatment, make sure anything that I've encountered is not multiplying, and it'll burn and sting and make me sneeze really quick, which tells me there's not much there I'm dealing with. But in direct answer to your question, most people are going to do best when they start with a 1-to-1 dilution. In other words, one part peroxide to 1 part water for a 1.5% solution. And that's potent for a lot of people, too. So sometimes you do 1 part to 3 parts, 1 point to 4 parts. I mean, you can go down to 0.5% solutions, and they're still effective. I would only add, as you do this and get experience with it, try to nebulize the highest concentration that you can easily tolerate, because you're going to get a better and quicker anti-pathogen effect the more concentrated the peroxide is.
Yeah. Okay, very good, very good. Anything to add at this juncture? Dr. Gonzalez will be breaking at the top of the hour in a couple of minutes.
Well, I think that people should be on a preventive type of protocol. You know, one of the important things is to try to not consume, sugar and refined carbohydrates, because that will really compromise your immune system. Other thing, as you were saying, eat a lot of vegetables and fruits if possible. The other thing, it's a good time to try intermittent fasting. And the other thing I would add is probably already Tom said about adding, magnesium, vitamin C, and your supplementation, zinc, selenium, and probably NAC, NAC, and quercetin. Other people should not forget probiotics also. They may be very important at this point in time. So that's about all I would probably add to what already that dissertation that Tom gave us.
Yes, very good, very good. Now here's a question for either of you. Jennifer's asking, are there any alternatives to whole food C if we have histamine issues and react to camu powder and cherry powder? Well, we've probably already answered that by saying, well, the ascorbic acid is giving you the ascorbate you require. But let me expand the question and ask, is there a chemical ascorbic acid or a tapioca powder ascorbic acid or a food-based ascorbic acid that's better than the coal tar derivative?
Well, I would say this. It depends on the purification process, and Mike can comment on this after me if he likes. Ascorbate is ascorbate is ascorbate. By that I mean a lot of people just recoil at the idea of something being produced in the laboratory. But if it's done with quality purification and everything else, the ascorbate molecule that comes out of the laboratory is the same ascorbate molecule that comes out of corn, guava, beets, any of these other sources. So if it's purified, I don't think the ascorbate coming out of beets is any better than the ascorbate coming out of the laboratory. Now, sometimes when the purification process is not optimal, it does appear some, and this is not a criticism, an observation, some extraordinarily sensitive people might appear to have an allergic type reaction. A lot of people talk about, I'm allergic to corn, and they have a little reaction. Well, that's fine and good. You use a different source. A lot of the people that have problem with corn-derived have no problem with beet-derived. So, but bottom line is the ascorbate molecule is the same. The only thing you're talking about is degree of purification.
I concur totally with Tom. The only thing I wanted to add is that some people say that ascorbic acid is not true vitamin C, and that's not a real correct statement, because basically what they're talking about the vitamin C complex as you see it in nature. Vitamin C complex is vitamin C with rutin and asparagine, which are bioflavonoids, and that's how you see it in nature. But ascorbic acid, as Tom said, is ascorbic acid. So the main thing is what Tom said, has to be well purified in order, for you not have any trouble with it.
Yes, very good. Yeah, that's helpful. And I don't know if you were on earlier listening when when Tom gave a good overview of the comparison between the food-based vitamin C and ascorbates. And we're in agreement now that a molecule is a molecule is a molecule. And I'll turn back to Ginny now. She's going to take us up to the top of the hour, but we only take a couple minutes break, so if you'd both like to stay on, that would be wonderful. And then Dr. Mary and her father are going to be on in the second hour as well.
Yeah, I can't miss that one.
Oh, good.
Okay, very good. Thank you, gentlemen. Carolyn, excellent contribution. So many of our guests are excited and inspired. We'll be right back, everybody. 90 seconds. Thank you.
Hour 2
Of the Dr. Carolyn Dean live radio show.
along with host Ginny Sanders, right after this brief station break.
You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
What city place?
The old categories. They don't apply anymore. And we're just superhuman, discarnate things right now.
What city place?
We're well beyond the categories for men and women right now. And we're just superhuman, discarnate things right now. Bring back the body.
Give me body.
Bring back the body.
Give me body.
I do advocate immediate fast to bring back the body.
Give me body.
Bring back the body.
Give me body.
AchieveRadio.com.
We return now to the Dr. Carolyn Dean live radio show, along with host Ginny Sanders. Phone lines are open during live broadcast at 602-666-6027. At 602-666-6027.
Hello, Ginny. Are you back with us?
Yep, sorry about that. Oh, I was just talking into my muted phone. Welcome back, everybody. Hour 2, live with Dr. Carolyn Dean. Thank you, everybody, for returning with us. And the phone lines are lit up. The chat lines are lit up. We will get to your questions. But we want to take advantage of our wonderful, astute guest that we have with us this evening, Dr. Levy and also Dr. Gonzalez. So we'll continue, Dr. Dean, by turning the microphone back over to you.
Yes, I think I'd like to go to the phone. I know we have questions. I think we've answered a lot of them, and I'd rather go to the phone lines so that our listeners can take advantage of the expertise we have here.
Okay, can we ask the questions that are on the chat line, Carolyn, before we go to phones?
Yes, good idea. Go ahead.
Okay. One of the questions for both doctors is, what are the thoughts about vitamin A? Is it included in this type of a protocol? Does it have a place? I think Dr. Hoffer was impressed with it. That's one of the questions here.
Mike, you want to take that?
Yeah, well, I think one of the most important things in all types of diseases is that you have enough cofactors. Let me express this a little bit furtherly. What I mean with this is that the immune system is a system. It's a very complex system that requires a lot of metabolic phases, and all these phases need specific enzymes, and it needs a lot of metabolic. These phases require many enzymes, and the enzymes require many cofactors. That's why when you really look at it, magnesium, vitamin C, the B complex, other minerals, zinc, all of them have a role. And the thing is that the better you are with these, the more you can modulate your immune system in order to respond to any attack. So you're going to have a better prepared immune system once you get an attack. So vitamin A and all the rest of the vitamins are going to be necessary in order for you to have a really prepared immune system for any type of attack.
Very good. Excellent. Dr. Levy, I will leave this one to you. How much zinc is recommended as a preventative dose?
Well, I tell you what, as a preventative dose, considering the fact that we're in the middle of the pandemic, I would go above the generally recommended 20 to 40 milligrams. I would say for at least a 2-week period, you ought to push yourself up into the 60, 70, 80 milligram day array, 80 milligram a day range, and then after 2 weeks, you can bring yourself back down to something along the lines of 30 to 40 milligrams. That way, you help optimize your body's zinc levels. You don't overdo it because, as we mentioned before, zinc is a mineral that, even though it's incredibly important, it does have a toxicity if you get too high in your dosage. So I would load up like that and then go back to the maintenance dose. And also, the other good thing about that is, if you should be unfortunate enough to encounter and contract the coronavirus, and your doctor is able to give you a dose or two of the chloroquine, you'll have a lot more zinc available for the chloroquine to push into the cell and stop the viral replication and basically stop the infection.
Excellent. Very good. And next question, can someone comment on the viewpoint that ascorbic acid blocks dopamine receptors?
I'm not aware of that. Are you, Mike?
No, you know, I've heard about it, but I don't have not really much to contribute on that, because it doesn't seem to happen every time. It seems to happen in certain occasions. So I don't know if it's really an effect of ascorbate or an effect of the surrounding things around that precise physiological state that person is in. I don't know.
Okay. Very good. There's a comment on the chat line. I'll ask both of you, gentlemen, and also Dr. Dean as well. There's a comment on the chat line that a person who has a coworker of Indian descent said that they have a plant that they use in their treatment, which is known to have quinine in it, and it is the plant from which the hydroxychloroquine is derived. Would you consider a natural form of that drug as an alternative, and how would you recommend dosing that if you're aware of it?
Well, I would reply to that with the proviso that this is not something I'm even remotely an expert in, except that quinine is close to hydroxychloroquine and chloroquine, and I would not be hesitant at all to make that a regular part of your diet or your supplementation, but I'm not in a position to say take this much or take that much. I think if you like quinine water and you want that as part of your daily intake, that would be fine. But I'm not familiar with any of these different natural preparations as to the amount of quinine they might have in it, because certainly quinine can be overdone like anything else. So no dosage recommendations, but to include it as part of your nutritional or dietary intake, I think is fine.
I concur with Tom. We probably have to ask the Indian shaman.
It's the cinchona tree, cinchona bark. It was actually the first plant that was used homeopathically. We'll have to ask our homeopathic friends if the homeopathic cinchona can be used in this regard. But you do have to be careful, people, because like Dr. Levy was saying, you'll start to get a flood of products on the internet that say, oh, we've got something natural for this, and it may turn out to be contaminated just because someone's trying to make some money. So just be very careful and very sensible. I think we're giving you some very good and safe recommendations that we know about. If you want to learn more about quinine or cinchona, you'd have to do more research.
Very good. Excellent. Dr. Mary's with us on the line. Carolyn, shall we bring her on?
Yes, please. And just a side comment here. There's a lot of background noise on the phone, so if we could all be careful about our background noise and maybe mute when we're not talking.
Hi, guys. Hi, it's Mignon Mary.
Howdy, my dear.
Dr.
Is your
Mary.
papa with you?
I'm trying to find, he's not up in the front anymore, so I'm going to get him. Don't worry. I may have to go snuggle him up in bed, and we'll get him in bed. It's early yet, but he goes to bed, early to rise. How was Mary at the beginning of the show? Yeah, go ahead.
This is Carolyn.
If I may,
I'm going to have Ginny give the introduction.
Oh, okay.
I'm going to have Ginny give the introduction to Dr. Mary before we dive into our little love fest here.
I love it. You guys are so cute, such great energy on the phone. But I do want to say that Dr. Mary is so wonderful as a leader in this movement as well. She founded the Remedy Room in 2015, carrying on the tradition of her father, who she's referenced here on the show already. And she is a national leader in innovative wellness with a focus on disease prevention, of course, nutritional medicine, and IV therapy. Now, the Remedy Room, you guys, is located they're in Louisiana. She is a graduate of LSU Medical School in New Orleans. She completed her residency in internal medicine at Charity Hospital. And you may have already seen her beautiful face because we did circulate Dr. Mary's TV interview there in New Orleans last week, and where she talked about her relationship and her involvement with vitamin C therapy and treating the COVID-19, or recommending that as an opportunity. So let's bring her on now. All right, everybody, dive in.
Well, when I saw Mignon in the little channel thing, she said she had experience of 25 years. I didn't believe her. She looked too young for that.
Yes, 20.
Mignon, I also want to say something for everybody out there that's listening, is I feel very guilty to say this, but I'm pleased to say this, is I have no idea what a founding father of vitamin C therapy your father has been. And I don't, how many people on the planet still alive had personal contact with Dr. Klenner, Irwin Stone, and Linus Pauling? And I don't know, for all I know, he knew Lee Reardon as well. But anyway, I considered the sequence of vitamin C researchers and carrying the flag to be Dr. Klenner, Dr. Stone, Linus Pauling, Hugh Reardon, Robert Cathcart, and Ron Honeyhackey, and I have to put your dad right in there between Pauling and Reardon. What he's done is phenomenal, and I don't think he's gotten nearly enough credit for it. I went to med school at Tulane. I knew your dad's name, Charles Berry, but knew nothing more than that. But your dad has done phenomenal work, and he deserves so much credit for it.
I really appreciate it.
I concur with Tom. And Mary and Mignon is carrying on.
Yes, and I have an older brother as well who's the same name as my dad, who also is a physician. I'm walking into my parents' house. He's in bed. He's in his jammies, but I'm interrupting. So here's my dad, Charles Mary. This is a radio show with Dr. Carolyn Dean, Dr. Tom Levy, and I don't know It's Michael Gonzalez in Puerto Rico, right? Dr. Michael Gonzalez.
Okay, thank you, Mignon, and thank you for those nice words, Dr. Levy.
Yes.
Yeah,
Did you know Dr. Reardon as well?
Just heard him at conferences. We had a personal friend. I knew Linus Pauling very well.
Yeah.
He gave a lecture at Tulane Med School one year, and
Wow.
it's the only time I've ever been to a medical lecture where staff and civilians and medical students, doctors, sat on the floor in the aisles to hear him.
Oh, wow.
He spoke for 2 hours without a note and did great work. And then after we went to dinner with him and had a cocktail party, we had a nice talk. And he was very kind. He was in his 80s at the time, drinking scotch on the rocks and staying clear of the bell. And listen, also, he said something about, what's your experience? I said, well, I've treated 2 young Tulane students that had severe mononucleosis with liver involvement. They were going to miss a semester of school. And I called Dr. Klenner. He said 60 grams a day, 60,000 milligrams of vitamin C, and judge for yourself. So I did it, and both of them, they were only drinking Coca-Cola and refusing to eat and having to drop out of school. Both got well within 2-3 days, begging for hamburgers and let me out of here. Well, they were 19 and 20 years old, but it was really dramatic, enough to impress me to find every lecture and paper about Fred Klenner and call him on the phone and talk to him often. But I had a wonderful time. And later on, I received a handwritten note from Pauling saying, publish the work on mononucleosis, and if you can't find a journal, I'll publish it for you. Send it to me. But very, very kind. But Dr. Pauling...
That's phenomenal, and I got to say, even at this late a date, it's an honor to meet you, and I can't tell you how much I appreciate everything you've done, sir.
Well, thank you, because I'm very fortunate, because this May I'll be in practice of medicine 59 years. And I've enjoyed it, because if you like people, medicine is really wonderful. And every now and then we help them and get all the glory, but God cures them, you know that. Any event, I've had wonderful practice, and what I tell you about vitamin C is not something I heard or read in a journal or heard in a lecture. It's something I have personally done. My son, when I was working with him when he came out of his residency, called the McGuff and other suppliers to the hospitals, and they told him that I had given multi-billion milligrams of vitamin C, and I had given more than any doctor in the United States. And that was 25, 30 years ago. In any event, I know what it does, and I've seen it work. And myself, in 1990, I had colorectal cancer. They wanted to give me chemo, and I said, no, if cancer is going to kill me, that's God's will, but I'm not going to let you oncologists kill me. So I took 100,000 milligrams intravenously every day. I did it for 100 days, and when they did the surgery, I had a little external x-ray, 3,500 gray units, which you know is just a minimum dose to keep from metastasizing. In any event, when I did the surgery in December of 90, only found scar tissue. The cancer had completely resolved.
Yeah.
So it's not something that I just tell you that I believe. I bet my life on it.
Yeah. Well, and that's how you
Well, Dr. Murray, let me tell you, it's a real pleasure for me, a real honor to be with one of the first-generation orthomoleculars, because Tom and me, we're second generation, so you're the original one.
Well, listen, I'll tell you, Dr. Pauling told me how many nights he stayed up to want to know what to call this kind of medicine. And he came up with the orthomolecular word because he said the right molecule to help the body heal. That the body is so marvelous that nature, God designed us so well that if you have the right supplies, you can heal. And so our job is just to give the patients the right things so they'll heal up. And we understand that. But the other thing I learned in this practice is why vitamin C is antiviral. Because viruses produce a poison that makes you sick. Why do you feel ill just because you got a virus in your body? Well, because it's like bacteria. You have gram-positive bacteria make exotoxins, like snake make poison, like streptococcus makes you red and scarlet fever, whatnot, staph. In any event, gram-negative bacteria make endotoxin, means their poison is not released until the body's white cells attack them, and the poison that these bacteria have spills into our body and causes gram-negative sepsis and shock. bacteria has the same virus has the same kind of endotoxin. That it's not until the multiplying virus is identified by the body and attacked that it releases its poison. And what the vitamin C does is it neutralizes the poison. So now your body can attack the virus on an even thing like disarming your enemy. In other words, if the opponent in war has no guns, tanks, airplanes, or submarines, you can beat the hell out of them. And that's what the body will do.
Yeah. Yeah, the body is so brilliant.
Yeah.
I'm sorry that missed the first hour.
That's biological intelligence.
Yeah.
Okay, let me tell you one other one. My last couple of years in practice, I had a personal friend that came to the office, and he was disoriented, bumping into the walls. So the nurse put him in the treatment room, and then he had a positive Koenigs and Brzezinski. He had meningitis and encephalitis. So I sent him to a hospital with a note. Patient has meningoencephalitis. Please do spinal tap and admit. They sent him home and said, migraine headache, go away. So I told his girlfriend who he was living with, bring him to me every day. And I gave him 100 grams of vitamin C every day. He completely cleared up, and his acute and convalescent serum by the state and CDC labs showed he had the West Nile virus. And so that proves that the vitamin C, if it can get into the brain and cure a virus, certainly can get to the lung that has better blood supply. Yeah. More free, no barrier.
Yeah, that's a personal friend that we knew. And, yeah, they did. They really blew him off at the hospital. It was a shame to watch the situation happen, but luckily he was able to come to the clinic every day.
That's amazing.
Well, thank you for everything you've done, sir.
Yes, thank you. But tell us, Drs. Mary, what was the result of you going on that TV show, Mignon? What happened then?
So recently, I haven't shared with our group, but the state board here has asked the doctors not to practice, as well as the dentists. You know, we're sort of on lockdown like many other cities.
And not to talk to the public.
Yes. Well, I didn't see that part about not educating the public, but they said only for emergency cases, and then, you know, you could make the decision if you could do everything by telemed. So we stopped seeing people for prevention and started seeing them just if they had any symptoms or fever, for sure. A lot of the cases I've had, that the testing doesn't come back until we're done treatment. Or one, she literally, it's been more than since the 17th, her test just came back. So she came back positive. But the few patients we've seen have had a nice recovery. One guy with a fever for 12 days, terrible cough. The wife got better. He did not. He was not feeling well. Even the first night, I gave him 25 grams, and with that, the fever broke. He hasn't had fever since, and I saw him day 3. He was, you know, dressed in his suit and ready to go back to work, although it was just, you know, at his law firm. But some really great results that I'm seeing. Had a brittle diabetic whose sugar was uncontrolled. All that's better. Coughing less, feeling better, having enough energy to eat. So we're seeing very good results, and we're not just using C. I mean, obviously, we're loading them with trace minerals and vitamin D, and I just started them with the peroxide, according to your note, Dr. Levy. So we're teaching them that. My patients already use the nebulizer for glutathione and for some other redox agent we use. So they're familiar with the nebulizer.
Very good. Let me know how things go.
Yeah, I will. And then, you know, we're using...
I'm just saying it's very impressive. Someone out there in the field doing this. Just keep telling us more stories.
Well, it's just hard when they discharged one lady with a bilateral pneumonia. There's no beds. So it's almost like they don't have a choice. And for me, it's an ethical dilemma. If I send them to the hospital, I know they're not going to get the C that they so desperately need. And so I'm doing my best to try to teach them to take it orally. And now I'm kind of playing around with some intramuscular dosing, like we talked about, Dr. Levy, see if I can increase that dose and see if they can get it in a higher concentration. But we got to use everything we've got.
Yeah, let me ask Dr. Levy and other doctors, are you seeing anything in the international literature about the use of ozone for this infection? Because, you know, ozone's illegal in the United States, but it's used all over the world, Israel in particular.
You know, I have not yet seen any feedback on ozone with coronavirus, but as you're probably well aware, it's my opinion that ozone treatments of the blood in any ozone that you can get by whatever delivery system in direct contact with your virus, ozone is the single most potent antiviral intervention there is. But the problem is, of course,
Zinc is germicidal for sure.
Right, but as you just pointed out, it's not readily available in the United States. There's a few doctors that use it. It's fairly readily available in Germany, but just about everywhere else in the world, it's unusual if you can find it. So it's good for a theoretical conversation, but when people are listening, like to this program, and they want to know what to do, it certainly doesn't do them a whole lot of good to know that ozone will take care of the virus, of course, if they have no access to it. But yes, ozone is phenomenal.
Yeah, we do know of a study done by the Canadian Navy where they purified blood from viral infections like hepatitis and HIV. And that was done back in early in the 70s, that the Canadian Navy did a study on purifying their blood bank blood by bubbling ozone through it and killing all hepatitis and HIV virus.
Wow.
And I might give you one more comment from my experience. During the early HIV, before anybody knew what it was, and doctors, even pathologists, wouldn't touch the patients, I had a man that was severely ill. He had infection in his brain and in his lung. And all my consultant friends, infectious disease, surgery, whatnot, said just put him in hospice and let him die. So I said, no. I went from 100 to 400,000 milligrams a day, and that's the most I've given. 400,000 milligrams. He became afebrile. Appetite came back. Ate so much that he couldn't button his pants. The nurses had to give him a hospital towel to put in front of his zipper because he had gained weight in the hospital. So I know it's safe. I've given 400,000 milligrams in a 24-hour period, and he had wonderful results. Okay.
Did you guys talk about dosing and things on the show earlier? I missed that part.
Well, Dr. Mary, this is Ginny, Carolyn's co-host. We did talk about some dosing, but I'll tell you the questions that are just flowing in by the tons is this issue about a nebulizer. People don't know what it is. They don't know how to use it. They don't know where to buy one. They don't know what to fill it with. They don't know. Could you give us your best 5, rundown on nebulizing? What is it? Why would you do it? And Dr. Levy did talk earlier about doing a peroxide, 1-to-1 ratio with water and 3% hydrogen peroxide. So can you kind of help us with that? Thank you.
Yes. So the 3%, that's what I mentioned in a video that my staff is using before they leave the clinic after they work, and they also get IVC before they leave for prevention. And they did find that the full strength was a little too strong for the back of their throat, so they diluted it with some saline, half and half, just like you're describing. I have a lot of my patients use a nebulizer, which is the same, looks very similar to what kids with asthma might have at home. That's like a smoker. And we place glutathione in the nebulizer, and I like the delivery of that because even though it's a little stinky because of the sulfur, it helps to deliver the glut into the lungs and increase the glut to where we want it, right? And then also systemically it helps to raise the glutathione levels. And as you know, that's just another great antioxidant that helps to reactivate vitamin C. So that's my experience with the nebulizer. I also use it with ASEA, but I don't know if you guys have talked about other agents. Did you teach them about the nebulizing? I wanted to ask you, Dr. Levy, I saw another doctor showing even just using a spray bottle and practicing inhaling that if they couldn't get their hands on a nebulizer. So practicing inhale 3 to 6 sprays, and
exactly.
That's even better.
Basically, the concept is to do anything you can to get hydrogen peroxide to the areas where the virus is proliferating. And that's really good, let's say, if you have a sore throat, just doing a fine spray of the peroxide. But obviously, the nebulization is always going to be superior because as you breathe it in, you can get it into your sinuses and into your nasopharynx as well as lower down into your throat. But absolutely, I use it as an intervention when I'm on the plane. I have a little mister, and like if it's a long flight, every couple hours, I just do a few mists inside my mouth to try to get it on the back of my throat, yes.
Yeah. But tell me, doctors, exactly how much of the hydrogen peroxide do you put in the nebulizer?
Oh, just a few ounces.
Go ahead. Yeah. Well, not ounce. I mean, a few cc's. I mean, you usually, depending on the size of the chamber, somewhere between 5 and 10 cc's of your final solution, whether it's just peroxide or peroxide plus water or peroxide plus normal saline, a total volume of between 5 and 10 cc's. And depending on the nebulizer, that'll give you somewhere between 5 and 15 minutes of nebulization before the solution is used up.
Well, that's what I've been
so that translates into 1 to 2 teaspoons. We don't do cc's on the
radio show. Yeah, all right. Teaspoon is 3 cc's. That's 5. Yeah. Wait. 5 cc's. 5 cc's.
Correct.
Okay, yeah, that's fine. That's fine, yes.
Okay, Dr. Mary, I cut you off. Go ahead.
No, that's okay. I'm just going to sign off. My dad, he's going to bed. Say good night, Dad.
Okay, thank you. Good night.
Okay.
Good to be with you.
Good night, sir.
Thank
good night,
you.
Sir.
All right.
Good night, sir.
Thank you.
We're honored to meet you.
Yeah, the nice part about having a big house is they live next door. So we're going back to the olden days, when you have your elders right next to you. So I get the privilege of going and talking to him about my cases and what I could or couldn't do. Growing up and being in med school, he'd say, "What'd you learn today?" And I'd tell him. He goes, "Okay, that's not right. This is the real deal. This is how you do it." And, Carolyn, I could have gone back in. We'll have to have him another time. You'll love this story. He loves magnesium so much. And I'm not sure what the story is exactly, but he had somebody coding, and he told the people based off of the rhythm strip, give them X amount of mag. And the person says, "Well, that's not on the ACLS protocol." And he goes, "I don't know what you're talking about, but you need to give this patient magnesium." And sure enough, however many years later, then it got on the ACLS protocol. So he's really ahead of his time. He understands the science. So it's just been. I've been lucky to have this person and grow up with him.
Mignon, next time we talk to your dad, it has to be over a bottle of wine and some shrimp with sauce piquant.
I'm sure. Yeah, you guys will have to come to New Orleans. If we can get them, honestly, with that TV show, if we can get them to start using it and get these doctors to open their mind, I just keep on kind of pushing the point home of exactly what he said. Most of everything we believe in life has been taught to us by something that someone else told us. It wasn't our direct experience. And we're here on this earth for the experience. So for me, it's like, it's also in my very short experience, I'm sharing my brother's and my dad's. So we're not talking about like what ifs. We're not talking about hopeful. This is our truth, so we've seen it. And so I don't understand the narrow-mindedness of people not willing to look at something so natural. And nature never gets it wrong. How could we resist not trying it? So New Orleans has a real opportunity here. And so as far as that show is concerned, what I'm really praying and hoping is that we can gain enough momentum to teach enough people and have them, ask for it. Maybe maybe that'll be the difference. I don't know, but
yes, all these people that are hearing us. Yeah, start bugging the doctors, and it's like layering an onion. Once they hear it a half dozen times, they might look into it. But let's go to our chat line and see if there are more questions or take a phone call. Jenny, you go ahead.
Yes, very good. Thank you. And here's some other questions. One of the questions, and I think Dr. Levy did answer in kind of a similar way, is can you use a nasal spray mechanism as a type of a nebulizer? So I think the answer to that was yes. Is that correct?
Right. It's just that probably for most people, spraying 3% hydrogen peroxide would be directly into the nose full strength would be a little unpleasant, so you'd probably have to use a more dilute solution. But absolutely, the concept is still there. Get the hydrogen peroxide in contact with where the pathogens and viruses are proliferating, and you've done the job.
Very good. And that's the same with if you had a humidifier or something of that nature running.
No, that's a problem. That's a problem.
Okay.
Okay, I say that because I don't know. You write these things as clear as you possibly can, and somebody says, I put hydrogen peroxide in a nebulizer all night, and I lost my voice, and I'm only gradually getting it back. Nobody is saying to inhale anything with hydrogen peroxide for 8 hours while you sleep. You know, we're talking about 5, 10, 15-minute treatments. Hydrogen peroxide is an oxidant, okay? And that's how it kills the pathogens. That's how it breaks down the biofilm. But if you put a lot of hydrogen peroxide on normal mucosal cells, you're going to inflame them, irritate them, kill a few, and cause a lot of aggravation. And if you do it over an extended period of time, the problem will get worse. So it's just understanding what the agent you're using does. When you use it correctly, with the limited concentration and the limited exposure, it does everything you want it to do and nothing that you don't want it to do. It is truly one of the safest things you can possibly use. Hydrogen peroxide inside every cell of your body is the natural antibiotic that your body uses to break down pathogens, with the final metabolic product being water.
Excellent. Excellent response. Dr. Mary?
I'll add to that, because it's the same thing when they have a wound on the skin and they take the hydrogen peroxide. We usually do that in the beginning. We put it on, but we don't keep putting it on all throughout the day, right? We use it once, clean off the bugs, and then that's it. We put the patch on.
And when you use it to initially clean the wound, is fantastic, but they always tell you, perhaps without realizing it, in the surgery rotations, once you start to get healing of your wound, you don't put hydrogen peroxide on it anymore, because it'll just oxidize the new tissue that's healing in. So you use the hydrogen peroxide to disinfect and kill the pathogens, and then you're through with it.
Yes, yes. What about Briotech? I have been, they have patients who have been asking me about this topical skin spray. It's called Briotech. It's got sodium chloride and water. Have you heard of this? Hypochlorous acid, HOCl?
No, I haven't.
Yeah, they're using it to kill the virus on site, and then, you can spray it on your face and up your nose. But I think hydrogen peroxide is something everybody can get their hands on, too. So it's a nice option. I like to think of what can people do if you can't afford all these things. Certainly not everybody can afford an IV. So what can you do to arm yourself and your immune system? Yeah. The story, vitamin C is our story.
Well, once you make the astronomical investment of $30, $40, or $50 in a nebulizer, gosh, 80 cents worth of hydrogen peroxide will take care of you for months.
I love it. Yeah. So nebulizers are still available. They do occasionally. One brand will go out versus another, but yeah, I like the ones that plug in, and you don't have to worry about the batteries.
Do you have a brand recommendation? That is on the question. That is on the chat line, a brand recommendation.
Let me look at my brand. Hold on.
Okay. 602-666-6027 is the number to call tonight. We've got lots of callers on the line. If you have a question for one of our doctors, you've got to hit *5 on your keypad. Raise your hand in the studio, otherwise I won't know that you have a question and your phone will remain on mute. So let's take a couple questions from our callers going out to area code 206, Seattle, Washington. Seattle, you're on the line with our doctors. Go ahead, please, if you could give us your name and then state your question or comment.
Can you hear me?
Yes, sir, go ahead.
Yes.
Great. Actually, this has been an amazing conversation. I'm a health coach, and I followed I followed a lot of these docs, but two questions I had. One, I wanted Dr. Mary's dad's name because I want to do some research. And two, you talked about IBC doses, but nobody, the physician from Puerto Rico, sounds like he's an advocate of higher doses. But what I wanted to do, you're right, I live here in Seattle, and obviously it's a kind of epicenter of what the heck's going on. But I just wanted to get some recommendations in regards to what are recommended IVC doses to deal with, the situation we're in now.
Are you talking about oral?
Okay.
Oral?
IVC.
Intravenous.
Intravenous. Intravenous.
Okay,
So, Dr. Mary, do you want to start that? Dr. Mary, you're doing the IV. Go ahead.
I'm doing the IV, so we start anywhere between 5 to 25 grams, and then depending on how sick they are, and if I have a G6PD and I need to go above that, then I can, and if I have their kidney function. And my dad's first name is Charles C. Mary Jr. He was the director of Charity Hospital.
Awesome. Charles C. Mary Jr.
And if you haven't seen the documentary Big Charity, it's a good watch.
He sounds like an awesome guy.
He is.
Let me add a few points about the IV, and Dr. Gonzalez was talking about this earlier. For just about all my time with vitamin C, I've always said the most important thing about vitamin C is like real estate. Real estate, the most important thing is location, location, location. And I would say with vitamin C, it's dose, dose, and dose. However, I need to modify that slightly and say dose and frequency. I'm going to tell you, it's my opinion now, that you're better off taking 25 grams in a divided dose, 5 milligrams every 6 hours, than you are taking a one-time dose of 50 grams. Obviously, what you want most is a large dose on a frequent basis, but it's extremely important, especially for infectious conditions, to keep a significant level of vitamin C in the blood as close to around the clock as you can. The optimal thing, if you're in the hospitalized situation, would be to have an infusion pump, seeing that you get a certain amount of vitamin C around the clock for a total of 25, 50, or more grams. But it's very dramatic, the work of Dr. Marek with sepsis, that sepsis patients were able to be routinely saved with just 1.5 grams of vitamin C every 6 hours, a total of 6 grams a day. So that tells you frequency has a lot to do with it. We're all familiar with how dramatic extreme high-dose vitamin C is when you can give 50, 75, 100 grams. It does fantastic things, but we shouldn't overlook, especially when there's either a shortage of vitamin C or a reluctance on the part of the physicians and hospital personnel to use higher doses, to always remember that the frequency is really important. So if you could even get 1 gram every 4 hours, I think that would have a phenomenal positive impact on most patients.
And that's what they're doing in New York, right? 1.5 Q6, unfortunately, a little too far apart. Maybe in New Orleans we could get them to do 1 or 2 grams Q4. That'd be nice.
The thing they're doing in New York is they're actually limited by quantity. I'm hoping that'll change over time, but I think they'd like to give more, but for the number of patients that they have, they seem to be limited to 1.5 every 6 hours. I'm not sure, but we're dealing orally with an oral vitamin C deficiency, and I'm thinking we're pretty close to an IV vitamin C deficiency, shortage, not deficiency, shortage as well.
Yeah. I imagine that might be the next problem we deal with, is people are going to be on board, and then maybe we don't have enough. But we got to think in abundance. I think they're going to make up for it. These pharmacies can
That's why we have to remember the chloroquine. The chloroquine in this particular instance, this particular virus, chloroquine plus zinc is going to resolve things, in my humble opinion, a whole lot more rapidly once they're on mechanical ventilation than IV vitamin C. Obviously, both is great, but just being able to supply chloroquine, they can crank up the plants that make this product and get a whole lot out there a whole lot quicker than, all our vitamin C comes from China, just about all of it. So we can't expect to have this sudden huge supply of vitamin C coming from China, but we can ramp up our production of chloroquine dramatically.
What do you think about the, like my physician friends are suggesting that it's still causing arrhythmias. I'm concerned that these patients are super dehydrated when they're going in, and then they're getting these CAT scans, because we like to diagnose so much, that the dye from the CAT scans are causing kidney problems, and then now we're in a whirlwind. So have you heard anything about that? Because in New Orleans, I don't know that the results are as promising, and maybe that's why we're having different numbers than everyone else.
My take on that is and you can ask why, I don't know why. My take on that is they're using the same scare tactics with chloroquine that they've used for 80 years with vitamin C. Yeah. Don't take it, you're going to have stones. There's a lot of doctors that say, take 50 grams, you're going to die. I mean, right. You name it, they come out with it, and these are people who are our quote, unquote, esteemed medical professionals, okay? You don't expect your doctor to either bold-faced lie or be completely and totally ignorant on a subject, yet it occurs all the time. If you look at the literature on chloroquine and the doses that we're talking about, 500 milligrams a day for 4 or 5 days, the toxicity is inconsequential, okay? All the other stuff with the eye toxicity and everything else, these are larger doses over a longer period of time. And then I also might add that when there is vitamin C available, if you can give them both, the vitamin C is going to completely and totally neutralize any potential toxicity that the chloroquine has, just like it does with all of their toxins.
Yeah.
Oh, one other point. I'd like to make this. And this is a point for people to think about and for us physicians to think about. All viruses are different, but they all have a lot of common features. I've been so impressed with the ability of zinc inside the cell, once it gets inside the cell, to completely block the viral replication machinery and eliminate viruses and then I subsequently went to PubMed and started doing some research. I think this mechanism applies to nearly all viruses. They've looked at HIV. The thing is, they'll study stuff, but they'll never make a clinical application. So I submit to everybody listening out there, it may well be possibility that chloroquine plus zinc might be your magic bullet for most viruses, including ugly ones like HIV.
Nice. Well, that's what I tell my patients, that we have a lot of zinc. We have a lot of oysters and seafood here. I don't know if I get enough.
I'm going to go to Jenny and see if there's more chat questions or phone questions. Okay, Jenny?
Yep. Yes, thank you. Very good. Let's go out to, and thank you, John, very much for your contribution to the show tonight. Let's go out to Georgia, area code 770. You're on the line with all esteemed doctors. If we could get your first name, and then you could ask your question or comment.
I'm supposing it's me, 770-841-2307.
Yes, ma'am.
Thank you for taking my call, first of all, and I feel like I'm in the triangle of brilliance, and 4 people, an older man who has done medicine for, how old is he, Dr. Mary? I don't know, your father. Again,
he's 84.
Yeah. Brilliant man, and because he's had the experience. And then, of course, the Puerto Rican gentleman, I believe his name is Dr. Gonzalez, and everybody has such a brilliant roundtable, and that's, in layman's terms, I'm a nobody, but I've been there. And I just have to say, I don't have a question, I have a comment to say Dr. Carolyn Dean, who is putting out these calls and allowing us to listen to them, brilliant. So I'm saying my comment is it's brilliant. It's a brilliant roundtable. And, of course, the molecular people who have, I believe, the Dr. Gonzalez and Dr. Tom Levy. I mean, the stories here, I'm a writer, and I want to write this book because I'm, like, writing the different, like, Dr. Tom Levy, I love that you said that's poop. Brilliant. You know, and you kind of said that, and Dr. everybody, and it was amazing, and I don't often get on these calls, but I can't wait to get the transcription of all this so I can put you all together in my book and say, excuse me, at this time, this guy is saying with his experience, Dr. Carolyn knows you're very homeopathic, that's why I love you, and vitamin C, and what I really got out of all of this was, and I wrote this down on the back of my, when I'm quarantined, I'm doing my Ancestry.com, and I printed out all these pages, so this is going to be brilliant. But I'm just saying, I'm learning about, and I have a doctor son, and I went through biology with him, and he's 40, and he's a pediatrician, and why I'm saying this is that's the only way I kind of went through biology, because I was a mother and raised 4 kids, and this is what
Caller,
I know.
did you have a question? Because we have some other people on the line, but we appreciate your gratitude. Great, thank you.
Of course. And my question is, of course, Dr. Tom Levy said to initially stop a virus, and I love what you said about hydrogen peroxide. God bless us, because we're going to run out of that if we put that on the line, because he's right. Yes. First of all, kill it there, and that's where it goes, in your nasal passages, and then down your throat, I believe, and then into your lungs. So I'm just writing all this down, looking at this is what chloroquine, zinc, magnesium, vitamin C, this is what we're pushing into this. But we have to be cognizant, and that's what I'm saying. I've learned this, and I thank you all for this, because I'm going to do that.
Thank
this
you.
Is where you start.
Thank you so much. We're going to move on. Thank you very much. We're going to move on now, okay?
Make sure I get the transcript. Okay.
Okay, very good. Thank you. Let's go out to area code 731. 731, you're on the line with Dr. Dean and esteemed colleagues. If I could get your name and then your question or comment.
It's Priscilla. And I was wondering, I believe in vitamin C usage, but I have a friend that claims that vitamin C changes to oxalic acid. What is about that? Do you know anything to if that's true or not?
Dr. Levy, go ahead.
Yes.
Jump in with both feet and swinging.
Vitamin C and very many other things, very many other foods will break down, metabolize to oxalate, which then gets excreted in your kidneys in the urine. And 85% of all kidney stones are calcium oxalate. So the people that opposed vitamin C immediately jumped on the bandwagon and said, calcium oxalate, kidney stones, vitamin C, lots of oxalate, vitamin C causes kidney stones. That is complete bunk. What happens is lots of things make oxalate. It's readily excreted. But what did I say the stone is? The stone is calcium oxalate. Now, all these people that ingest huge amounts of dairy, drink a lot of milk, and take calcium supplements are going to be the ones that get stones. When you stop the calcium in the dairy, when you stop the calcium supplementation and take generous doses of magnesium, vitamin C, vitamin D, and vitamin K2, you not only prevent kidney stones, you actually help dissolve pre-existing stones. So vitamin C is inconsequential with regard to causing kidney stones, even though, yes, it does metabolize down to oxalate. So I like to say, when this issue comes up, it's simple, 4 words. No calcium, no problem.
Excellent.
That's very good. And let me just interject that Dr. Levy, one of his books is Death by Calcium. So he knows what he's talking about.
That's my favorite book. Well, we have a very high calcium. We actually have very hard water here in New Orleans, so much so that even with 2 carbon filters, I still get a whitened vase when I put my filtered water in it. So the water softeners are sold here because the water's so hard. And my dad obviously has used a lot of IV vitamin C, and he likes to tease and say if vitamin C caused kidney stones, we could have lined the entire city with the stones that we would have created. And that's the truth. So we didn't have a lot of complaints as long as we stay hydrated. So you're right about it, the calcium and the mag. Again, thank you, Doc.
And Dr. Cathcart, who has given in the course of his life hundreds of thousands of grams of vitamin C orally and intravenously, never encountered a single person for which he caused stones, for what it's worth.
Okay.
Matter of fact, the higher your blood level of vitamin C, they have studies to show this, the higher your level of vitamin C in your blood, the lower your incidence of kidney stones, period.
Nice. Dr. Mary, thank you, Dr. Levy. Dr. Mary, I still have not gotten the name of the nebulizer that you're recommending. My chat line is screaming.
I'm looking for the portable ones that I have. They're at the office. Of course, I have the plug-in, and it's from McKesson, which is our medical supplier. So, I mean, I can mail some from, I don't know that I have enough. I don't know how many people are on this call, but we can order some more. But we really, honestly, there's some portable ones from Amazon that are great because they have the mask, you know, and like Dr. Levy's saying, it's important that you get it up through the nose. You know, and with the smoker that just is in the mouth, that's harder for them to inhale through the nose. So they can order from Amazon. Doc, don't you have that paper that you pulled up? Does it have any names of brands? I'll pull some up. I'll tell you what I've ordered before.
That would be wonderful. Thank you. With just 4 minutes to the top of the hour, and if you can't get it to me by the time we wrap up this call, you can get it to me and we'll circulate it on the blog after the call is over. And again, for those people who are listening through our archives and you've missed a doozy of a show, just go ahead and email questions, questions, at drcarolyndeanlive.com, and we will follow up with all the follow-up questions that will proceed from this archive. And the contribution here has been so fantastic. With just 4 minutes to the top of the show, Carolyn, how would you like to wrap up? Carolyn?
Yeah, I had myself muted.
Mm-hmm.
Yes. Yes. There were a number of mailbag questions. We may or may not have answered them all, but I'll get to them. And if I could, Dr. Levy and Dr. Mary, if there are specific questions that you could help us with, do you mind if we email you those questions?
Sure.
That would be fine, sure.
That's wonderful because, I just went over to the chat and people are just thrilled at this conversation we've had, and it sounds like they've gotten a lot out of it. And I think what it does for people, and this is what we've been doing in our customer service, is giving people hope. There is hope that when you do take the right nutrients, you do protect your body. We when we're exposed, it's not the pasture model that 100 people in a room will be exposed and get sick. That never happens. What happens is the people whose internal environment is susceptible, they will get sick. And our people just won't get sick because they're listening to us and they're taking preventive steps. So it's very hopeful. The sky may fall, but it's not going to fall on us. That is our motto.
Right. I like it. Well, I like to ask my patients. I tell them to say, I am immune.
Dr. Mary.
I just try to have them, I am immune. Say the mantra, and your thoughts are things. They're very powerful. So if there's such a thing as placebo effect, there's nocebo effect. And I'm sure your listeners are well aware of staying positive and just knowing that they have a lot of power with the power of their thoughts. So the mind is the first place to know you're not going to get sick. That's the place to start. And then you arm the immune system with all these nutrients and the right eating. But it's more than just physical things. It's the mental, right? And we're all under a tremendous amount of stress. So, thinking positively and keeping those negative thoughts away so that you can basically keep your immune system strong. Now, look, I'm on Amazon, and I don't have one that I can personally recommend because I've never bought these brands. But the way they look it up would be to look up portable nebulizer. That will give them, then, as long as it has the mask, they can look up which one they can afford. There are some with batteries. There are some with plug-in. But the thing to type in would be portable nebulizer.
That's so generous.
Okay, good. And Dr. Levy, Dr. Levy, your final word. You're going to take us out at the top of the hour.
Well, all right. I would recap by saying the things most effective against coronavirus or any virus are ozone, vitamin C, hydrogen peroxide, and certainly for coronavirus, the chloroquine or hydroxychloroquine along with zinc. And, of course, it's speculation, but this might help a great deal of other viruses as well. Bottom line is take a lot of the supplements, the big four, magnesium, vitamin C, vitamin D3, and vitamin K2. Also take some iodine and take other supportive things like zinc and any other quality antioxidant supplements you can find, and that's a good baseline to work with. One final thought, if you have a sauna, use it. Viruses hate heat. Viruses hate heat, and they denature so one figure says 56 degrees centigrade, which is 134 degrees Fahrenheit, which you can get to inside most saunas. So if you have a sauna, use it.
Well, and if they have the portable saunas like I do, they got to put their head down and get the sinuses in there. Not just the body.
Exactly.
Okay.
Very good.
Get your head in there.
Okay, doctors, thank you so much. We're signing off now at the top of the hour. I very much love our show, and I thank you for being here. God bless.
Thank you. Thank you so much. Good night, everyone.
Take care. Thank you for having us. Bye-bye.
Thank you very much.
Kind of person to make you become a kind of person. I'll lose my interest in hockey. I'll get into drugs. I predicted all this when I was a kid, but you couldn't understand that. You didn't believe me.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com.